Welcome back to Face the Nation. We turn now to former FDA Commissioner Dr. Scott Gottlieb. He joins us from outside his home in Connecticut. Doctor, good to have you back with us.
Thanks.
You've been talking to Congress, you talked to the administration, and you've been clear that you believe there was a failure to plan in January for March, and you're saying now in March we need to be looking ahead and planning for May. Exactly what is it that all of us need to be planning for?
Well, right now we're engaging in broad-based, population-based mitigation techniques, things like stay-at-home orders, closing schools. These are population-level techniques to try to break off chains of transmission. That's the right thing to do in cities like San Francisco and New York, where we see hotspots, where we see epidemic spread. Unfortunately, we're not engaging in those tactics across the whole country. There should be some form of mitigation across the whole country because we're all at risk. But we need to start thinking about how we transition away from that. Come April, come May, when the epidemic curve starts coming down, we can't just take our foot off the brake immediately. We need to start including and introducing what we call case-based interventions, trying to do mass screening and identify people who either are infected or who have been in close contact with people who have been infected, and go towards more of an individual person approach rather than a population level approach. That planning needs to be underway right now. We need to know how we're going to slowly transition into another paradigm. It's not a question of either or. It's a question of substituting in other techniques that are less intrusive for what we're doing now.
You heard Dr. Fauci say there's no doubt we're going to get hit. He mentioned New York. There are some projections from New York hospitals that a peak could hit within the next 20 days. What is it that Americans need to be prepared for?
Well, I think that the scenes out of New York are going to be shocking. I think that the hospitals in the next 2 weeks are going to be at the brink of being overwhelmed, and we're going to start to see places like Javits Convention Center and other facilities used to start to house people. They're going to start getting thousands of admissions coming into that city. And this was infection that started 2 weeks ago. The time to hospitalization is 9 to 12 days. I think there's other cities that are at extreme risk. New Orleans is at very high risk, and they're not taking appropriate measures. This is a sticky virus. We're learning that much more of the transmission probably happens from touching contaminated surfaces. So any city that has a mass transit system is probably at risk and needs to be taking very aggressive steps. Cities like Chicago, San Francisco, New York, Boston. You've seen San Francisco implement tough measures. Illinois recently implemented tough measures. We need to continue that right now.
Is there an existing antiviral drug that is effective in at least containing this or preventing someone from getting seriously ill?
No, there's drugs that look promising. There's drugs that are in proper trials. We really need to continue to conduct research to figure out what works. Right now, there's no drug that looks like it's proven so overwhelming in early stage clinical trials that we can say it's highly promising. There's drugs that suggest that they may have activity against this virus. But the other question is when you introduce the drug. Sometimes when you introduce an antiviral drug late in the course of the disease, after people are in the critical care unit and very sick, it may not provide a benefit. Sometimes you have to introduce an antiviral drug earlier, and that's how we treat the flu, for example, with drugs like Tamiflu. We introduce them earlier in the course of the illness, and that's where they have their greatest benefit.
So you would agree with Dr. Fauci that there needs to be clinical trials of hydrochloroquine and azithromycin, which the president said he thinks is already effective?
Absolutely, and that may not be the drug that ends up holding that was promised. The study that looked at that drug and showed activity was a study that involved about 20 patients and only 6 in the arm that showed the benefit. And the benefit that they showed was that they decreased the amount of virus in their noses when you did nasal swabs in those patients. So it could very well be that the drug is reducing viral shedding but having no impact on the clinical course of those patients. So the data on that is very preliminary. What we need to do is what we call a master protocol, where we basically test a lot of drugs at once. We randomize patients to different treatments so everyone gets a treatment if they need it, and we figure out which is working the best. That's what we did with Ebola, and we came up with some very effective treatments against Ebola.
The Trump administration announced this past week that the first trial through NIH of a vaccine was started out in Seattle. Given the timeline for this, do resources need to be refocused from a vaccine into some of the treatments that you were talking about?
I think absolutely. We could have a drug, a potential prophylactic drug that could prevent people from getting an infection or even treat an infection as early as this summer. especially when you look at some of the approaches where companies are developing antibodies that directly target the virus. I think this is highly promising. We need to be putting a lot of resources into that. Senator Daines introduced a provision in Capitol Hill that may be included in the final package, and what it would do is it would basically scale up manufacturing right away for the promising treatments that make it into the government-sanctioned trials, so that if one ends up working, we're ready to distribute it on a mass scale. You have literally millions of doses available. Now what's going to happen is a lot of those drugs won't work, and we're going to end up throwing away the drug that we manufactured, but I think that's a small price to pay for the benefit of having drug available if in fact one proves that it's working.
In other words, taxpayers helping to subsidize some of this research immediately. When do you see us being able to plan about going back to normal life?
Well, I think it's going to be a slow transition. I think that the epidemic right now that's underway is probably going to peak sometime in April, probably late April, and tail off into May and June, and hopefully transmission will be broken off in July and August. We need to plan for what we're going to do in the fall to prevent another epidemic and outbreak, but life's never going to be perfectly normal until we get to a vaccine. We're always going to have to implement some measures, but they could be case-based measures where we look at individuals and screen very aggressively for the virus and quarantine and isolate individual people rather than quarantining mass populations. That's what we need to get to. That's going to be a transition, but we can get there. There is a light at the end of this tunnel.
Dr. Gottlieb, thank you. And we want to go now to the President and CEO of the American Hospital Association for the latest on how hospitals are battling the pandemic. Richard Pollack joins us from downtown Washington this morning. Good morning to you.
Good morning, and let me just say at the outset, I just want to recognize the unbelievable work that's going on in our hospitals by the doctors, nurses, and other healthcare workers. Their dedication and their efforts are ones that we should all very much appreciate.
And I think everyone in this country would agree with you on that point, sir. I want to ask you, though, about what we need to know and what Congress should be focused on getting to those medical workers.
Yeah.
There's about $110 billion promised in this emergency legislation. What does that get the doctors and the hospitals around the country? Is it enough to meet the need?
Yeah, it's a start, and it's a very good start. The American Medical Association, the American Nurses Association, and us, the Hospital Association, all said that we needed a minimum of $100 billion. And we're hopeful that that package will deliver us the assistance that's needed, the tools and resources that are needed so that we can continue to respond to this crisis. This is an unprecedented situation in which we're entering uncharted waters. The congressional leadership on the Senate side, in particular Senator McConnell and Senator Schumer, are very attentive to this matter. Mm-hmm. We're hoping to see legislation that provides us with assistance when it comes to increasing capacity, when it comes to paying for overtime, and very importantly, when it comes to helping us with cash flow to sustain our operations. We could see hospitals close in this situation as well because they just don't have the resources.
The White House and the American Academy of Surgeons has publicly called on Americans and hospitals to reschedule elective surgeries because they don't want to overwhelm hospitals and they want to save equipment for those worst case scenarios. Do you now support that? Because I know you weren't supportive of that call for a while.
No, that's not quite right. We support guidelines that were put out by the federal government around the notion of elective surgery. And we have found that in most cases across the country, that is the case. Sometimes there's a little confusion between what's considered elective surgery. There are things that might be elective that are in fact life-saving,
well, so
like replacing a heart valve. But there's no question that we have stopped doing that in a lot of areas.
On what you're saying is too nebulous. Do you think there need to be specific guidelines set out saying hospitals stop these kind of elective surgeries, plastic surgery, for example, knee replacement?
Are
those kind of specifics? Well, state and districts is what you have said should be able to make those calls. Do you want the federal government to provide more clarity on that?
Federal government has already done it. The Centers for Medicare and Medicaid Services has put out guidelines. We support those guidelines.
Okay. So how do hospitals then determine who can get needed medical supplies, things like ventilators? Is there a process? Is there a guideline in this, or is it luck of the draw?
In terms of ventilators, we're going to need more. There is a supply. Many people have them, but there's a gap, and we're going to need more. But the most immediate thing we need is personal protective equipment the masks, the gowns, the goggles, that type of equipment to protect our healthcare heroes that are on the front lines. That is what is most essential now. If we don't protect our healthcare workers, the system will completely collapse. That's what's necessary. And that's why, in fact, we need to see the Defense Production Act employed in an aggressive manner. It's great that people are stepping up, but we need to be more aggressive in getting those supplies to the front lines.
Right.
They may be flowing, but we need more.
Right. No, and that is why I asked Dr. Fauci about that. Thank you very much, Mr. Pollack. We will be right back. We now go to the chairman and CEO of FedEx, Frederick Smith, who is in Memphis, Tennessee this morning. Good to see you. Thank you for joining us.
Good morning.
Our latest reporting is that this bill Congress is still negotiating contains about $8 billion in rescue money for carriers. Will your company be seeking any part of that federal aid?
I don't think so at this point in time. It would only be available or needed by FedEx and the all cargo industry if things really get bad, and then only in the form of loan guarantees. Now, the passenger carriers, which have a $50 billion package, that's a different story. They're in very dire straits with significant lack of demand. That's not the situation with us. In certain cases, our business has actually increased because of this situation. In others, it's declined. So I doubt that we'll need it, but it's a good thing to have there so we don't have to shut down long-term projects like facility construction and purchase of airplanes and trucks and things of that nature.
Provide some certainty for your planning. But your CEO of one of your divisions, FedEx Express, signed onto a letter yesterday that was released. He signed alongside some of those passenger carrier CEOs, and it urged Congress to swiftly pass this bill they're still negotiating, or saying there will be mass furloughs, there will be mass layoffs. What size of layoffs are we talking about? What is your company expecting?
Well, FedEx is not expecting any layoffs at all. Quite the contrary, our people are working very heavily on both the business-to-business side, moving things for hospitals and diagnostic labs, picking up specimens and getting them into the various locations where they can be tested. The passenger carriers, again, that's a completely different story. They have very little demand at the moment for their services. And if they don't get this $50 million relief, and I think that's mostly loan guarantees as well, they will begin massive layoffs. They have no option.
There are, for you in the cargo side, you are still able to function to deliver things around the world, but there are significant travel restrictions. What are you seeing in terms of supply lines staying open?
Well, we began to deal with this problem in our operations in China in January, and there we took extraordinary measures to protect our people and our pilots. Just last week, for instance, we flew 246 flights in and out of China. So we've been dealing with this for a long time. China's now actually back mostly in production. About 90% of their big factories are open. Their smaller businesses less so, but about 70%. So with the shutdown of the passenger operations across the Pacific, we have significant backlogs coming into this country and a significant amount of traffic going back to China. More recently, the same thing's true across the Atlantic. Our Purple Tail airplanes are carrying a lot of stuff both ways. Passenger planes, which carry a lot of cargo in the underbellies, including some for us, they're all but gone from the market.
But it sounds like you're saying trade can continue, though passenger travel is restricted. I want to ask you about the safety of your employees as well here. I mean, there are reports that we saw in the New England Journal of Medicine recently saying that this virus can survive on different surfaces for different periods of time. On cardboard, it can survive for about 24 hours. How do you protect delivery workers who are literally going to Americans' front doors?
Well, we have massive efforts underway in all of our facilities to try to socially distance folks and their workstations. We're providing gloves and all kinds of antiseptic swabs and things of that nature. For people that are receiving packages, the CDC says not too much risk, but if you've got concerns, take a little alcohol and rub it across the package after it's left on your door, which is what we're doing. We suspended the requirement for signatures in certain cases. So I think the risk is low, and we're doing absolutely everything we can, cleaning our facilities prolifically. The place I'm talking to you from, one floor up, we had an employee last week that tested positive for it. We cleaned the building. We have lots of people working from home. So you just have to work through the issue using every measure at your disposal. We're moving prolific amounts of hand sanitizer, for instance, in our freight company at the moment.
I'm sure you are. Fred Smith, thank you for joining us and giving us your insight. This crisis is having an enormous impact, as you just heard, particularly in the airline industry, but that is the entire travel industry that is affected as well. And we're going to turn again this week to our CBS News transportation correspondent, Kris Van Cleave, for more. He joins us from our newsroom. Kris, we were just talking about the bailout that Congress is putting forward. This has billions of dollars, not just for airlines, but for retailers, for hotel companies. How much time does this buy them before we see layoffs?
Well, the airlines say if they get the package they want, they can avoid furloughs until at least the beginning of September. I can tell you, though, at least 2 regional airlines have already said they're shutting down because of the coronavirus and the drop in demand. Marriott Hotels has already started furloughing what it expects to be tens of thousands of workers, not only frontline workers, but also amongst their corporate staff, as Marriott has started to shutter some hotels temporarily because demand in the hotel industry, they're running at about 25% of what they should be typically, and the airlines are seeing passenger loads at 20 to 30%. It's just not a viable business without help.
There's been this debate over whether the U.S. government and the U.S. taxpayer should essentially just hand over money in a grant to these airliners, or whether it should be essentially a loan that could end up looking something like taking a stake, as they did during the auto bailouts. What is it that the industry is actually asking for?
Sure. So the airlines are asking for a mix of immediate grants to keep their payrolls operational through at least the end of August. They're also asking for a package of loans and some tax changes, some tax benefits that would help them weather this. You know, an airline told me that, listen, they're going to operate about 40% of the network they were operating just at the beginning of March. And they said, we can't afford to be 40% of an airline with 100% of the payroll unless somebody steps up to fill in the gap. It's just not viable. What's in the Senate bill appears to be a package of loans, and airlines and their labor unions are worried that that won't be sufficient to to avoid large-scale furloughs in the airline industry. The hotels are already seeing that, so clearly there is a pressure to, from the airline standpoint, to get an influx of cash immediately. In exchange for that, they've said that they will not furlough workers until at least September, that they'll put limits on executive compensation, stock buybacks, and dividends, and certainly Congress can add other terms to that.
So functionally, what does that mean? Is air travel essentially going to be shutting down?
Well, we just today saw that Emirates, one of the larger global carriers, is going to suspend all passenger travel later this month. U.S. air travel domestically, the president has said he wants to keep it going domestically, at least for absolutely essential travel. But the airlines without any support say they'll be out of money in the coming months. Already, we've seen a dramatic decline. Some numbers for you. A year ago, TSA screened 2.5 million travelers in a day. On Thursday, they screened fewer than 600,000. At the beginning of the month, they were screening about 2.5, 2.3 million. You can see the drop-off, 76% decline in travel. Yeah. That's very challenging, Margaret, but the plan is to keep the planes flying for now.
No doubt. Kris Van Cleave, thank you. We'll be back in a moment. 60 Minutes correspondent John Dickerson is our resident presidential historian. So we asked him for his thoughts this Sunday about leadership in times of crisis.
As America struggles through quarantine, we're all improvising, officials at the podium and parents at the kitchen table, as we shift to a social distance archipelago, each island 6 feet apart. This marching coronavirus is new, but America has faced similar times: the Great Depression, World Wars, after 9/11. Each crisis has produced a leader. The names were different, but there is a pattern.
The only thing we have to fear is fear itself.
Franklin Roosevelt targeted fear in his inaugural address because while his programs would take time to kick in, the fight against fear could start right away, and success in that fight would make future ones easier. We could use a little of that. Every television seems tuned to the panic station. 75% of us say we're worried, according to one poll. But Roosevelt didn't dismiss fear. He gave Americans a ladder over it, reminding them of all that previous generations of Americans had overcome and survived. After FDR's speech, one listener said, "Any man who can talk like that in times like these is worthy of every ounce of support a true American has." A leader helps tell us who we are, says Reagan's speechwriter Peggy Noonan. We lean forward, hungry to hear, she says. Now we will hear the thing we longed for. That's how leadership works. It's not just blowing a trumpet, but sounding a call that people hear and respond to. It's the difference between a locker room speech and locker room talk. The best leaders trust the public and make them allies, says Amanda Ripley, who has studied disasters of all sorts and how to respond to them. The public performs extremely well when they are treated like grown-ups and told the truth. This is why Dr. Anthony Fauci has become a hero. People crave facts. Leaders know people don't panic when they are informed. Instead, they are spurred to help. President Eisenhower said leadership consists of nothing but taking responsibility, including for everything that goes wrong, and giving your subordinates credit for everything that goes well. A leader taking responsibility, no matter what, shows that someone asking for sacrifice is also willing to sacrifice. Showing grace in that duty also puts a leader in worthy company with all the nurses, doctors, and other Americans who show us every day that while the vaccine will come from the laboratory, the will to fight is already inside us.
And we'll be right back. We thank you for watching Face the Nation today. We've worked hard, mostly from home like many of you, but we are here with minimal staff. We'll be back next week to continue giving you the best information that we can. Today, we end with a view of isolation around the world and remind you we are all in this together. I'm Margaret Brennan.